Good afternoon. My name is Bryson Webb, and I'm the chairperson of Western Health's Board of Trustees. It's my pleasure, on behalf of the board, to welcome you all to Western Health's Annual General Meeting 21-22. A land acknowledgement is offered to recognise Aboriginal people's enduring connection to their traditional territories, to recognise the history of the land that is currently shared by many people, and to recognise stewardship as a shared commitment of all those who reside in a territory. The practice of territory acknowledgement is itself a replication of an Aboriginal practice which predates European contact. We acknowledge that the land on which we gather is in traditional Mi'kmaq territory, and we acknowledge with respect the diverse histories and cultures of the Beothuk, Mi'kmaq, Innu and Inuit of this province. For the last 2 years, as a result of the pandemic, we have broadcast our AGM. We decided to hold our AGM virtually again this year, as it may potentially be available to a larger group of people throughout the region. The AGM will be recorded, so if for some reason you experience issues during the live broadcast, you will be able to watch a recording after it is finished. As we move through today's agenda, I would like to make note that those of you who are joining us for the AGM today may go to the question icon during the meeting and post a question there in the question and answer section. And we will address these questions at the end of the AGM. I'm very pleased today to welcome Mr. Dave Diamond to our AGM. In June, Mr. Diamond was appointed Transitional CEO of the Provincial Health Authority in Newfoundland and Labrador. Mr. Diamond is leading a project team designing the organisational structure and change management strategy to support the health system transformation envisioned by the Health Authority. Mr. Diamond has served in various healthcare roles over the years, most recently as the President and Chief Executive Officer of the Eastern Regional Health Authority since his return to Newfoundland in 2014. Mr. Diamond held various leadership roles with Alberta Health Services, including Chief External Relations Officer and Senior Vice President of Human Resources. Prior to this time he spent with Alberta Health Services, Mr. Diamond was the Chief Operating Officer and Vice President at Capital Health in Edmonton. At Eastern Health, Mr. Diamond enhanced engagements with leadership, staff, physicians, and focused on aligning healthcare services to improve patient care, mental health, and addiction services, as well as population health. In 2020, Mr. Diamond, in partnership with academic and private senior partners or private sector partners, introduced the first ever innovation strategy to improve patient outcomes through a living lab. Since 2015, Mr. Diamond has served on the Board of Directors for Healthcare Canada, a national voice of action for healthcare facilities and hospitals across the country. As both chair and now past chair, Mr. Diamond holds a Master's in Health Services Administration from the University of Alberta and a Bachelor of Commerce in the Co-op program from Memorial University of Newfoundland. So, Mr. Dave Diamond, I welcome.
Thanks very much, Bryson, for the introduction and the welcome, and for the opportunity to be here and be part of the annual general meeting for Western Health today. And I really appreciate being able to share just a few thoughts in terms of where we are in the planning for the new provincial health system. As you've already indicated, I've been doing this new role since the 1st of June, and we've had quite a busy summer, and is not slowing down any this fall. There's been lots of foundational work that's been underway, and I'll share some of that with you, including around organizational, some of the principles for the new organizational design. We've been doing some jurisdictional scanning, working with the other provinces who have gone down this road of provincial health systems previously. And we've got a variety of work stream activity that we'll talk about in some of our later slides, as well as stakeholder engagement. So it's been a busy summer, and the fall is certainly lining up to be equally busy as we contemplate what needs to be in place for a new provincial health authority as early as next spring. I know from my previous roles as CEO and senior leaders in the regional health authorities, what some of the challenges are. I shared those challenges until recently around recruitment and retention and access, and all of what needs to happen to try and meet the needs of the people in the various regions that we serve. And but we've all as well, while we had shared challenges, there are some unique things with each of the regional health authorities, some unique challenges and also some successes. And I'm sure we'll hear lots about the successes of Western Health today, and some of the successes that we'll hear about in Western Health and around the other regional health authorities is really the strength on which we'll build this new system. So lots of good things happening, and a few challenges, lots of challenges really over the last 2 or 3 years. And I've been thinking today, even as we've been preparing for this presentation, the current ongoing challenge for Western Health in supporting the folks on the Southwest Coast, Port aux Basques, and along the South Coast through the pandemic. I spent a day on Monday in Corner Brook and had a chance right after the weekend to see all of the activity from a leadership perspective in Western Health lined up to help with support, particularly around the mental health support. And kudos to the organization for the good work that's ongoing there. I really think the regional health authority structure that we've had in place in the province for more than 15 years has actually served us quite well. I think we've had very good governance, and we've had good leadership, and we've had good structure. And so there's some very, very good things that have happened for healthcare in the province over that period of time in the structure that we currently have. All of the RHAs are doing lots of work to provide safe and quality care, a lot of work in continuous quality improvement, and I know that's been a big focus for Western Health, and just stewarding the responsible stewardship around our human resources and our financial resources. So there's lots of good things, but while we're all doing our best to meet the needs of the populations that we're serving, coming together now as one provincial organization, the merging of these 4 organizations and all of the strength that represents, along with hopefully some of the IT capability from NILSHI coming together, creates, I think, some new opportunities for us to pool and share resources, to share things like clinical guidelines and practices, and enhance the patient experience, and ultimately with the goal of improving the health of the population. Next slide. Only. The Health Accord, I suspect everyone or almost everybody who would be represented here today would have knowledge of the Health Accord, the recommendations, the work that Sister Elizabeth and Dr. Pat Parfrey did over the last 18 months or so on the Health Accord. I think a seminal piece of work really for the province that's getting a lot of attention now, even in other jurisdictions in the country. And one of the things that the Health Accord did for us is remind us what many of us already knew, and that the health of the people in the province of Newfoundland and Labrador is is not where it needs to be. So from a population health perspective, on many of the indicators where people across the country and different provinces and different regions get measured, the health of the people of this province tend to be towards the bottom of those lists, and that's not where any of us want to be. And so the whole purpose of the Health Accord was around exploring that and making recommendations of ways that over the next 5 and 10 years and beyond, we could transform this system, into the kind of system that, when it's firing on all cylinders, should be able to, in the long term, positively impact the health outcomes for the people. I'm not going to go into all of the recommendations of the Health Accord today. Obviously, the move to a provincial health authority was one of the 50-odd recommendations that were made. But if we're going to achieve the transformation that's envisioned by the Health Accord, then we need to change, or to use the terminology of the Health Accord process, we need to reimagine the health system and how the system is designed, and how we work together, and how we interact with and navigate in the health system. So again, building off the very good work of the regional health authorities over the last number of years, but reimagining what else we could do in a more integrated more integrated system. Next slide. Our goal then, taken right out of the Health Accord, which is the guiding document, I would say, for not only the design of the new system, but the strategic priorities for the new system as we get into planning after next spring, is our goal as a project team is to design an organization that really enables that transformation. There's lots to be done, so there's more than 50 recommendations in the Health Accord if we're going to achieve that transformation. We're looking at, from the project that we kicked off on the 1st of June, and that hopefully will take us up to probably an April timeframe. Our goal in a phase 1 of this is really to look at what are the basic pieces of organizational structure that we would need to have in place to ensure a smooth transition from the current RHA structure and the current leadership structure and governance into the new organization. And so that's what we're about. Lots more transformation work and discussion to be done, but we think that'll be done once we get the provincial system in place to be able to deal with that. Next slide. One of the things that is not, early on in this process, and there's often angst in these kinds of change, and I've been through a half a dozen of these in my 30-odd years in these kinds of leadership roles. Always people look to these kinds of mergers and think that it's all about job cuts or budget cuts or centralization, and there's good reason for that, because often it has been, and often that's the mandate that health authorities have gotten from government to drive change. But this has actually been quite different. I've been really pleased with the discussion I've had early on with government around what they're mandating us as a project team, and myself as the CEO going into a new authority. What is it? What are their expectations? And I've been pleased that job cuts and budget cuts, those kinds of financial imperatives, are actually not what's driving this change. It really is about the trying to do the improvements envisioned by the Health Accord. And so we've been asked to minimize the disruption as we go through this, to make any changes, if there are to be changes with roles, that those changes be done through attrition. We haven't been given budget targets, and we're looking now on what a budget might look like for the new organization. And it's not about centralization. So one of the really positive things that we've learned through COVID, to state the obvious, because this is a discussion that's happening in all industries and certainly across all of healthcare, that we learned lots through COVID about what we can do with technology to ensure that actually our organizations can be quite decentralized. And so one of our guiding principles as a planning team is that we're not looking to centralize staff. If you're a payroll officer today and you're working in St. Anthony and supporting payroll function for Labrador Grenfell Health Authority. There's no reason why you can't live and work and stay in St. Anthony and using technology support the new provincial payroll system. And you can think about those examples across many corporate services functions, but also more and more we can think about that even in clinical functions as virtual care gets expanded as, again, one of the other visions that we have for what can happen in this new provincial system, and that is to maximize a strategy around virtual care and what that could do to improve access. So these are some of the things that it's not, and I think it's important to say that because oftentimes these kinds of transformations get sidetracked with agendas that are not as much about the improvement in care. Next slide. So we have some guiding principles. The Health Accord challenges us quite a bit to refocus the system, particularly around the social determinants of health and what we can do to improve population health. And I know that's been very much a part of the discussion in Western Health over the years. And those of us who have been leaders in other regional health authorities have looked from time to time to Western for the level of thinking and some of the work that's been happening there. And the Health Accord is very much focused on its reimagining of the system being about social determinants. We've identified a number of principles as we're doing the work to try and scope out a draft of an organizational structure. These are some of the things that are guiding our thinking. Obviously, we want an organization that is really focused on quality and safety. We need to create that culture of safety, but also around accountability and transparency. The Health Accord talks a lot about that. It talks about being a learning organization, being able to use data to drive evidence-based decisions, to have indicators and targets, and to be reporting those, not just through the organization and up to government, but out into the community as well. And so quality and safety and the issues around accountability and transparency are very much a part of the thinking. Accessibility and could be number one on this list, but I think about accessibility. If we're not able through this transformation, this reimagining of the system to improve accessibility in many areas of our system, then I don't think we'll be as successful as we need to be. People need to be able to access primary care differently in the province. People need to be able to access care between community hospitals and regional hospitals and tertiary centers. People need to be able to access specialty care in a timely way. And we hope in some cases to be able actually to deliver specialty care closer to home with visiting clinics and other new and innovative models that might bring specialty care closer to some of our rural areas than we've envisioned previously. Workplaces are critical, again, referenced a lot in the Health Accord, the physical and psychological safety, the decentralized and dispersed staffing that I talked about earlier, but also leadership. And so one of the things we want to build into our structure is to ensure that as we envision Western Health, Western Regional Health Authority transitioning into a Western zone, within that Western geography, we want to ensure that we have the right level and also the right amount of leadership. So again, a plug not to centralize in this exercise, but actually to maintain the leadership that we need in the geography to be able to appropriately manage the services, to be able to appropriately support staff and physicians, and to be that connection into the community, which again, very important if you read through the various recommendations in the Health Accord. We want a system that's people-centered, particularly interested in the social determinants and the marginalized populations, but also in partnerships. So advisory committees are connectivity to municipalities, to various non-governmental agencies within the geography and so on. So people-centered as well as part of what's driving the planning. Next slide. Continuity of service, so to provide a seamless service across people's lifespans. The partnership with private and academic partners is part of what I just talked about. And also to have seamless geography. So you'll see in a minute that, you know, one of the basis of how we're designing the system is based on geography. And so we'll have likely 5 zones within the province, Western Health transitioning into Western Zone, likely with the same geography as Western Health. But the boundaries in this zone-based structure will be very, very porous. They actually will mean little or nothing as far as patients being able to access care across the province. And it really is mostly an administrative structure as opposed to a structure that in any way restricts the continuity of services that we're looking to drive. The learning organization, I talked a little bit about the whole idea of evidence-based, of constantly measuring and setting targets and reporting and learning as we go and transitioning based on the best evidence. And then efficiency, sustainability, and effectiveness. There are certainly opportunities as we come together as 4 or 5 organizations coming into one over time with minimal disruption and with any change being made through attrition. I've no doubt that we'll find efficiencies, even as we think about what technology can do for some of our administrative areas. Then there's lots of opportunities there. So those are some of the principles. Next slide. In terms of then our approach to designing the organization, there are various ways that different jurisdictions have gone about the design process. We've chosen to really rely quite a bit on the internal bench strength we have within leadership in the province. We have within the regional health authorities and within government, we do have lots of strength to pull on. And so primarily we've populated our various work streams, our project teams with internal people, and we've supplemented that where we've needed to with a variety of consulting support. We've learned from the other jurisdictions. We've talked to Alberta and Nova Scotia, who were 2 provinces pretty early out the gate in moving towards provincial systems. But we've also talked to Saskatchewan, and they have more recently moved to a provincial system. Manitoba has done some things to consolidate. New Brunswick has gone from a number of regional health authorities into 2, a French and an English system. And we've spoken to all of those folks, and we're trying to get all of the learnings so that we don't repeat any of the mistakes if we can avoid it, but also take the best of what they've done. We're also working with clinicians and staff and managers from across all of the RHAs. We've worked a lot at the leadership level so far, but as we move into October, we'll be out with a very broad engagement strategy that will allow opportunity for staff at all levels of the organization to be able to speak in and provide their advice around things like the organizational structure. We've also engaged an expert panel of academics, people who are studying large health systems within various jurisdictions in the country and around the world. And we've asked them to speak into some of the design elements, and that's been a very useful exercise to provide advice and to verify some of the work and thinking that's happened with our own leadership teams. We've had some consultant review. The individual who led a provincial health system restructuring in Saskatchewan has been providing us with some advice on the very successful change process that has been underway in Saskatchewan. And so we'll have a final organizational design. We have a draft now that we're hoping to meet with government on next week. Our vice presidents and some of our leadership, clinical leadership, are speaking into that. When we get through the discussion with the government, we'll be in a position in probably mid-October be able to share that quite broadly. So we're pleased with how that part of our process has gone over the summer and early in the fall. And if all goes well, and we expect it will be, we'll have that structure out for that broad discussion in a couple of weeks. Next slide. In terms of the organizational structure itself, there are, while I don't have the structure to put up today, but I will in a couple of weeks to be able to, there are some things that we've coalesced around. We are working with government on the governance structure. The governance structure and the legislation, the development of new legislation is very much in the purview of the government. And so while as a project team, we won't be designing what the governance structure looks like and being directly involved in the appointments, we do know that there will be one provincial health authority board, and government is drafting some legislation to that effect as we speak. That will hopefully be ready to be pronounced this fall. I'm anticipating a board perhaps around the size of 15. I'm expecting it'll be a competency-based board, so we'll be, and we've amalgamated competency matrices from Western Health and from Eastern Health in particular, as we've made some recommendations on what the kinds of competencies that a competency-based board, what government should be looking for in a competency-based board. So that we hope to be in a position where the legislation is passed in the fall, and perhaps as early as December and January, we would have a new provincial health authority board named. The existing boards would stay on until the end of March and carry on with the responsibilities that they have. But if we had a board named early in the winter, we'd be in a position to be able to do the work around creating committees, looking at bylaws, looking at policies, looking at orientation. It would be, I think, a very useful period of time to have the new Provincial Health Authority Board in place prior to perhaps an April timeframe. There will be, in the zones that I spoke about, we're anticipating Labrador Grenfell Health, Western Health, and Central Health as regional health authorities with the existing geography rolling over into the new structure as zones. And so we're not anticipating the geography changing there. Where we are anticipating a change will be in Eastern Health, because Eastern Health is so large compared to the other health authorities. We're contemplating splitting Eastern Health to take the rural component of Eastern Health, so Carbonear, Clarenville, Bonavista Peninsula, the Urban Peninsula, and making that a zone, which would be roughly, the same size as Western. In each of the zones, there will be health councils. Again, if you've had an opportunity to review the Health Accord, it talks about health councils to allow for that voice of the community within the geography. And so while we're tweaking a little bit, what that might mean, we're anticipating these regional councils to be advisory as opposed to governance. But we're looking for a very robust structure to be able to support the chief operating officers within the zones and have a direct relationship with the board. So there'll be zone health councils. We know there are advisory committee structures in all the regional health authorities, including in Western. We're looking to build some of that, looking to build advisory structures and looking for ways to potentially take the concepts like the health neighborhood concepts from Western Health and build that in to continue on as an advisory structure within the zones, perhaps reporting up through the zone health councils. There will be in our structure within each of the zones a chief operating officer and then a management and clinical leadership structure, physician leadership structure within each of the zones, so that that kind of day-to-day operational work happens on a local level. And then a small number of vice presidents as well. And you can think about what some of those would be around. We'll need a VP of HR and finance, likely IT. We'll need a VP of medicine. We'll need a VP of quality. We're also looking at some vice president support for the transformational work of the health report. And so one or two vice presidents that might be focused primarily on the transformation work in the health report is kind of where our minds are at this point. Most of the day-to-day operations we anticipate being managed up through that structure in the zones. And so the chief operating officer within the Western zone would have a lot of the accountability and expectations of a current CEO, obviously not reporting to a board, but reporting to a provincial CEO and being part of the provincial executive team. But nonetheless, a lot of the operational accountabilities will stay within the zones. We do anticipate as well a small number of provincial programs. So currently we have cancer, for example, as a provincial program, where we've been in the process of rolling out health and corrections as a provincial program. There's been lots of discussion in the last number of years around lab as a provincial program, medical imaging. We have been having a discussion whether cardiology is an important enough area that would be a provincial program. So there will be, and we'll have things like human resources and finance will operate in a provincial environment. But we don't want too many of those because we're really looking to have the day-to-day operations managed within the zone structure. And so the more provincial programs we have, the more it waters down that concept that the day-to-day operations in a geography like the Western zone, our view is that that's best managed within that geography up through that operating officer. But we will have those small number of provincial programs. And a lot of the transformation work in driving new models and new ways of doing business and innovation and standards, because if we simply stop at 5 zones and a small number of provincial programs with no real way to connect the service delivery across the geography, we really won't have achieved. We certainly won't maximize the benefit that we could get around accessibility, for example, and seamless integration of care and movement of patients around the province. And so we've looked at an idea from several other provinces, a clinical network idea. So in some critical areas, and you can think about surgery and critical care, emergency services, seniors health as examples where we would anticipate clinical networks that are resourced that would tie the surgical programs, for example, across all of the zones and bring the right leadership, clinical leadership and administrative leadership around the table to drive that discussion of new program development and standards and provincial policy as a way to really drive that transformation work that we'll need to do to achieve the vision that's outlined in the health accord. Next slide. We have a very small transition team. When we started out, we thought we might pull a half a dozen people from around leadership within the province. As you would know as well as we do, the health systems across the country, including in the province, are very fragile at the moment, given where we are at this stage of the pandemic and with the level of fatigue and so on, and then the human resources challenges that we've had since the summer. So we've opted not to pull a lot of people out of roles on a full-time basis. I'm in my role full-time. We have our admin assistant, Kathy Fitzpatrick, is full-time, and then Ron Johnson, who is a vice president at Eastern Health, who has some expertise in project management, is working part-time on this project, in addition to his Eastern Health responsibilities. And Gaetan Villeneuve, who's the communications leader in Labrador-Grenville is working part-time on the project, as well as working in her full-time job. And so that's the team. We brought in on a very part-time basis the lady who did work for us, or led the transition in Saskatchewan, and she's helping us. But that's the team. And so again, what we've done is we've connected almost all of the leadership, the vice presidents and the CEOs from across the province in various work streams. I'm just going to do a quick time check. Bryson, I see you come up on the screen there, and that might be an indication that I'm running out of time and you'd like me to clue up. So I don't want to interfere with your agenda. So I'm just going to do a quick time check.
No, go ahead.
Okay, good. I'm almost done in any event. So next slide, Tony Lee. We have a variety of work streams. So this is work that's been happening through the summer and into the fall that I think all of your senior leadership within Western Health have been connected into one or more of these streams, legislation and regulation and board governance that the government are primarily leading. We're speaking into, but the clerk of the council is leading that work. We've got lots of work happening in the health accord, the 50-odd recommendations. The provincial health system is only one of those. Dr. Parfrey has been appointed as a temporary, for an interim period as the Deputy Minister of Health Transformation. He's working on a variety of the other recommendations, and we're meeting with him on a regular basis to ensure that our work is aligned with what he's doing on the health accord. We've got some discussion that's happening around IT and where IT would fit in this new system, and we don't yet have a final decision on that, but we're optimistic that operational pieces of IT will eventually migrate in to support the new system. The organizational design principles we're working on as a project team. We've got a work stream around human resources and labor relations with the vice presidents from around the regional health authorities and leaders from Treasury Board and government who are helping us with HR strategies and what bargaining units could look like. The finance VPs are working on a way to consolidate our budgets this year. So we'd be ready for the beginning of the new fiscal year with a consolidated budget and some mechanisms for reporting on a consolidated budget. The VPs with public health responsibility and community are making some recommendations about how their programs could be run. We've got some work on change management and engagement. Clinical integration mechanisms is the provincial programs and the strategic networks that I talked about, and medical governance. So at the same time, the VPs of medicine are working with us to make some recommendations on medical staff bylaws and what the structure needs to be around medical leadership, medical advisory committees, and the leadership structure in the clinical world that will align with what we're thinking about on the administrative side. I'm going to maybe go to the, I'm going to go to the last slide, Tony Lee. Sorry, back up one more. There we go. Just in terms of next steps. So we're 4 months into our planning. I think our full planning horizon was likely 10 months. And so we have 6 months left to go. I've talked about where we are in the planning. There's, in all of those work streams, there are recommendations coming in from each of those areas as we speak. We're meeting with government next week to test the assumptions and make sure we're still aligned. And then we would anticipate quite a significant broad engagement around the details of some of our governance structures, our advisory structures, our organizational structure, the clinical networks and provincial programs, starting in mid-October. We're doing a lot of work on change management with a change management strategy, and we anticipate actually bringing some resources onto the project team. We're looking at what big organizations across the country have as far as capacity in their organizations to support big change, and we'll look to replicate some of that and bring it on as part of the project and migrate it over into the new organization when we get set up in April. And the legislation, we hope, will support this by as early as October, November of this year. So we feel there's a lot of work that has gone on. We're in a good place from a timing perspective. You know, before I close, I would just like to say a big thank you to Western Health, certainly for the invitation to speak today, but also for a lot of work that has been happening, and the senior leadership team in particular in Western Health have been a part of all of that and have committed a lot of time and have created a culture, I would say, around this change, which is most impressive. As I said earlier, I was in Corner Brook on Monday and had a chance to speak to all of the senior leadership team, and I've been most impressed with the approach and how they're seeing the opportunity in this and taking the opportunity to speak into this and help us design a new system that's going to work for the province and work for the people on the West Coast. So thank you so much to the senior leadership team. Thank you to the board. We felt lots of support over time from the Western board. You know, these kinds of changes are never easy, and there's always upside and downside. But we felt from Western Health good support, and we look forward to ongoing engagement so that we can make sure that the kind of system that we design and roll out in the spring gives us the best opportunity to do what I think we all want to do, and that is improve the health of the population as it's envisioned by the health board. So, Bryson, I'll turn things back to you. Thank you again for the opportunity, and I'll stick around to hear the good things, the updates from Western Health on the strategic plan, and but also be available at the end if anybody has a specific question that you want to punt my way. Thank you.
Thanks very much, David Diamond, for that very detailed presentation. Our board is certainly appreciative of the hard work and dedication that you, David, and your project team have put into supporting the transformation of the health system as it's envisioned by the health card. I would be remiss if I didn't remind you, but I know you need no reminding, that the needs and the health priorities of individuals, communities are different throughout Newfoundland. And we certainly hope that the new structures will recognise and respond to those differences. So thank you again, David. And if anybody has any questions for David, please put them into the question and answer period, and David will be happy to address them, I'm sure. We will now proceed into the rest of the business, and we have the minutes of our AGM meeting of September 24, 2021. They have been circulated to the board, and if anybody would like to make a motion to adopt these minutes, please unmute and make your motion.
So move, Richard.
Richard Parsons has moved the adoption of the minutes. Would somebody unmute and second that motion?
It's Lloyd, I second that.
Lloyd Walters seconds that motion. All in favour, aye. Just please unmute.
Aye.
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 We have the motion and the minutes are adopted. We now go into the presentation of the audited financial report, which will be given by the chair of our Finance and Property Committee, Brian Hudson. So, Brian, the floor is yours.
Thank you, Mr. Chair. Hopefully I'm coming across here fairly clear. If you'd, perfect, thank you, Bryson. If you can give me just a few brief minutes to talk about our audited financial statements. In particularly, I'd like to bring your attention to the consolidated statements of financial position. Of note, the receivables decreased for Western Health Regional Authority, $10 million. This decrease in receivables is mainly attributed to government funding for our general operating grant and the capital equipment being received before year end, which was March 31st, 2022. Our bank indebtedness, or our debt as it's known, decreased $13.3 million. This decrease in bank indebtedness is the result of increases in government funding during the year, and a small surplus occurred in the end of fiscal 2021-2022. Payables and accruals increased approximately $3.5 million. The main contributors to this increase are approximately $661,000 accrual for Workplace NL, $761,000 for salary accrual, $1.2 million for time owed bank, and this was higher than normal because of COVID and the inability to grant time off. And finally, $562,000 accrual for client payments. With regards to deferred capital contributions, they increased $2.4 million. This was mainly due to COVID, and which subsequently we were unable to implement several repairs and renovation projects, totaling approximately $3.3 million. Also, the worldwide slowdown in supply chain caused delays in receiving some of the equipment items. With regards to our consolidated statement of operations, total expenditures decreased from our approved budget, $10.7 million. Many programs and services were reduced due to the impact of COVID. This resulted in a reduction in expenditures. Also, the budget, which was approved for full operations within Western Long-Term Care. However, not all units were opened and in operation throughout the fiscal year. There was a $6 million surplus in direct client costs due to lower than anticipated growth, and $2.5 million related to physician vacancies. The expenditures also include approximately $18 million in direct COVID-related expenditures. Overall, our deficit decreased $16.1 million. Western Health had a small surplus of $5.6 million at the end of the current year, an improvement, I should note, of $21 million from the previous year ending 2021, and a $16 million improvement then budgeted for the reasons I've already identified. Accrued vacation expenses also increased $1.8 million, and as mentioned previously, this is due to staffing constraints experienced during the COVID pandemic, which many staff were not able to avail of. That's just some highlights, Mr. Chair, from the financial, the audited financial statements, and I have a couple of motions to bring forward to the board. The first one being that the board approve the audited financial statements for 2021-2022.
Would some board member second that motion?
Lloyd, I second that.
Lloyd Walters has seconded the motion. Please unmute and indicate a vote for the motion.
Aye.
Aye.
Motion is passed. Brian, you have the appointment of the auditors, I believe.
That's correct. I move that we appoint Grant Thornton as the board's auditors for 2022-2023 for the consolidated health operations.
Somebody want to second that motion?
Second that, Richard.
Richard Parsons has seconded the motion. All in favor, aye?
Aye.
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 Is passed. Anything else, Brian?
Yeah, another motion there, Mr. Chair, to appoint Mr. Brian Barker, CPA and CA, Chartered Professional Accountant, as the board's auditor for the cottage operations for 2022-2023.
Somebody want to second that motion?
I'll second. Mark here.
Okay, Mark Mills has seconded the motion. All in favor, aye?
Aye.
Aye.
Motion is adopted. Thank you. Anything else, Brian?
Just a note, Mr. Chair, that under the question segment later on, if anyone has any direct questions that's viewing this presentation today, they can certainly ask myself, and our Director of Finance, Ian Stark, is also online.
Thank you very much, Brian, for that presentation. We'll now proceed with the next item on the agenda, which is a report from the chair. Our annual general meeting provides an opportunity to reflect on the work that has taken place over the past year and to consider our priorities for the coming year. Today, I will share some of the work done by the board and the progress on achieving Western Health's strategic goals. Then, Michelle House, our CEO, will provide an overview of some highlights and accomplishments for the organisation. I would like to take a moment to recognise our fellow board members. The board's commitment as an organisation and to the people of the region has been evident throughout the work we've accomplished this past year. Our trustees, Edwina Bateman, Marie Brennan Downey, Brian Hudson, Mark Alexander Mills, Richard Parsons, Sheldon Peddle, Scott Porter, Lloyd Walters, and Keith Watton make up an excellent team that I am honoured to work alongside for Western Health. All of you have provided valuable input based on your backgrounds and experience and have been wonderful ambassadors from various communities throughout the region. Thank you all for your guidance, leadership and devotion that you bring to your volunteer governance role. The Board of Trustees values engagements with partners throughout the Western region. We know we're stronger together. This engagement enhances our ability to work together to improve the health of our population. Over the past year, we are fortunate to have had several engagement opportunities, especially through our partner engagement sessions, which were held in February and March of this year. Through these sessions, the board gains a better understanding of what the needs are in our individual communities. It should be the upcoming areas of focus. Now I'm going to share some of the highlights about our strategic issues and the progress we have made this past year. This past year was the second year of our strategic plan, which covers 2020 through 2023. And the first strategic issue is our people, and that Western Health will have enhanced workforce capacity and capability through enabling an engaged, skilled, well-led and healthy workforce. This year, in order to make improvements in the scheduling department and help support the challenges with staffing, 4 initiatives were implemented. And these initiatives were initiating a lean process improvement project to identify efficiencies in scheduling processes, extending the hours of schedulers to align to demand, adding a scheduling supervisor to assist schedulers, finally initiating a pilot to send group texts to staff for available overtime rather than having to call staff individually. This year's guidelines for reducing sedentary behaviour at work were also shared to provide ideas, tools and resources to help increase activity in the workplace and to support employees' health and well-being. The Human Resources Department also initiated steps towards a business partner model aimed to enhance human resource support for our people and managers. These efforts are all to help Western Health's our people goal. The second strategic issue is quality and safety. For Western Health to have improved quality and safety across the organisation in all priority areas. To support reducing patient harm, The regional deteriorating patient initiative was implemented at 5 acute care facilities. Also this year, 10 new quality and safety improvement teams were assembled to improve measurement of access to services and wait times. An inventory of areas that currently collect wait times was developed and is accessible for staff on Western Health's intranet. And the third strategic issue is innovation. That through innovative models of service delivery, Western Health will have improved access to health services in key priority areas. This year, all emergency departments in Western Health were linked virtually to help support collaborative care model. In addition, the Health Neighbourhoods website was launched, where individuals who do not have a healthcare provider can submit their information to be added to a wait list for a primary care provider when there is availability. An implementation plan to expand community paramedic access in priority areas was also developed. You can see Western Health is well on its way to achieve the goals set out in these very important strategic issues. And the progress that has been made to date is very positive. The annual report includes more information about the work accomplished in our strategic issues. And I encourage you to take a look at the annual report for 2021-22. I believe that is now on our Western Health site. In conclusion, I want to extend my gratitude to Western Health employees, physicians, volunteers, and partners for the amazing contributions you've made over the past year. Western Health was faced with significant challenges as the COVID-19 pandemic continued. We had a cyber attack which impacted service delivery, an extreme weather event caused roads closures. The Southwest Coast was cut off from the rest of the region for a week-long period. Western Health's employees, physicians, and leaders continuously rose to the occasion to work together and overcome the obstacles and challenges they face. Your commitment and dedication to the people of Western Newfoundland has been unwavering. Also, would like to thank our health foundations and auxiliaries for their acts of kindness and giving within our communities, which have had a tremendous positive impact on our patients and families throughout the region. The board is pleased with Western Health's accomplishments for 21-22. We will continue to work together with our people and our communities to achieve our strategic goals in support of the strategic directions of the Government of Newfoundland and Labrador. I now pass the meeting over to Michelle House, our CEO, to share some of Western Health's highlights and accomplishments this past year. Michelle.
Thank you, Bryson, and thank you everyone for joining us this afternoon. Our AGM is an opportunity to reflect on some of the accomplishments we have achieved in the organization over the past year, and many of which Bryson has spoke to, and I'm glad to have the opportunity to speak to you as well. Today, while I'll be sharing some highlights with you for 2021-22, I would like to take this time to acknowledge the challenge experienced this past weekend on the Southwest Coast. While many of our leaders worked on emergency planning in anticipation of this weather, we had no idea the impact the storm would have or the devastation that would be experienced. We are truly heartbroken for our communities and the people impacted both directly and indirectly. I had the opportunity with senior team to visit Port of Ass on Tuesday, and the pictures certainly didn't prepare us for the level of devastation that we did see. I want to assure you that we know there are many needs and we'll work together with our many partners to respond. I also want to acknowledge and sincerely thank staff and first responders who stepped up to respond to those in need, many of whom had impacts of their own. I was truly amazed, and I know the senior team were truly amazed by the commitment of our staff, the hope, the resilience, and I just want to certainly take that opportunity to acknowledge that. Despite the several challenges we have experienced at Western Health, as Bryson spoke about, we have been able to accomplish many great things throughout the year. Western Health collaborated with the School of Fine Arts at Grenfell Campus Memorial University on a Picturing Community project. I'm hoping that many of you may have seen it here at Corner Brook if you've been in Corner Brook. If not, I really encourage you to drop by at the town hall to be able to see it. Through recreational therapy staff at Corner Brook Long-Term Care Home, 14 residents were selected and worked with photography students. After building a rapport with the residents, the students captured images of the residents, which told their story. The student photographers interacting with the residents provided a great opportunity for intergenerational socialization. The project also provided an opportunity to showcase residents in their home environment and promote healthy aging. The City of Corner Brook displayed large format photographs of the residents in the windows of City Hall, which was enjoyed by many visitors. Over the past year, there was a focused effort to enable different professions to expand their scope of practice, which is of great benefit for Western Health. The scope of practice of licensed practical nurses expanded in the community support program to include things such as negative pressure wound therapy, compression dressings, and IV medications. This advancement in practice supports LPNs to work their full scope of practice, enables better utilization of resources, allowing RNs to provide other necessary care and improve access for our residents. To support efficient and timely access to COVID-19 testing, professionals other than nurses were trained to administer COVID-19 tests. Western Health worked with regulatory bodies on training requirements to support this function and with employees to ensure competence in skills prior to implementation. This expansion in scope of practice enabled easier access to testing for clients and contributed to employees' continued competence. A new model of care was initiated at Bay St. George Medical Clinic in September of 2021 to support primary care. A virtual NP and one RN was hired to support enhanced virtual care. The RN performs such functions as mental health assessments, patient education, injections, completes patient profiles. The goal is to have the RN expand their scope of practice to perform other services such as cervical screening, chemotherapy injections, to increase the time available for physicians to provide care to patients. Over this past year, significant mechanical, electrical, and architectural upgrades were made to the pharmacy at LeGros Health Center. These upgrades were required to meet National Association of Pharmacy standards. These upgrades ensure the production of IV products meet standard from a patient safety perspective, while guaranteeing staff safety as well. The pharmacy at Dr. Charles LeGros Health Center is the first pharmacy in the region to meet these standards. Renovations will take place this year in the pharmacy at Sir Thomas Roddick Hospital. During the summer and fall of 2021, mechanical, electrical, and architectural upgrades were made to support the installation of a new CT scanner at Sir Thomas Roddick Hospital. The new scanner provides better quality images with faster scan times, increased clarity, and greater detail, assisting radiologists in detecting injury and illness. The scanner also has a larger opening, which helps alleviate anxiety for some patients when they are having a CT scan. There was also significant work completed this year to prepare for the new acute care hospital. Construction of the facility is ongoing, and the service commencement or the facility handover date is planned for November 2023. Every time I say that, I can't believe how close we are. During the months following Western Health, During the following months, Western Health will transition to operating within the new building. Exterior and interior construction is on schedule, and the new hospital project remains on target. The new acute care hospital facility obtained the water tightness milestone in July 2021. Engagement is a key priority for Western Health in the planning for the new acute care hospital. Regular meetings take place with our Person and Family Centered Care Steering Committee to hear feedback from patient partners about wayfinding, patient entertainment, facility name, and construction updates. Feedback from the Halibut First Nation was also received for the cultural garden design. Our staff members in pharmacy, laboratory, medical imaging continue to be involved in planning for equipment and workflows as a part of the operational readiness for the new hospital. This engagement has been crucial in identifying areas of improvement as well as recommendations for the new equipment required. There are a number of programming services that are currently located at Western Memorial Regional Hospital that are not a part of the new acute care facility. We refer to these programs and services as out of scope from a planning perspective, but they are critical to the delivery and support of our programs. This past year, there have been progress made in planning for the relocation of these programs and services, including laundry, the Western Regional School of Nursing, our hostel, and our ambulatory or outpatient and non-clinical programs. Now I will outline some of the priorities as we look ahead to this upcoming year. Maintaining optimal staff levels is key to providing high quality care. Human resources poses the greatest challenge for healthcare, and as you've heard earlier, Western Health has a strategic goal priority focused on our people. Innovative recruitment and retention strategies are essential to meet the healthcare needs of our communities. In January 2022, the provincial government announced the establishment of a provincial health professional recruitment and retention office to assist with the development of a comprehensive provincial approach to recruitment and retention. We look forward to engaging with the Provincial Health Professional Recruitment and Retention Office and collaborating on this provincial effort. Throughout the past year, Western Health continued to navigate through unprecedented challenges with the COVID-19 pandemic. The persistence of COVID-19 will undoubtedly continue to have impacts on the healthcare system, and the challenge will be navigating these pressures while maintaining services and recovering from service disruptions that occurred through the past 2 years. Health Report NL released its final report in February of this year with a vision to improve health and health outcomes in the province over the next 10 years. A recommendation included in the report was to create a provincial health authority, which we've had the opportunity to hear much about today. This transformative change has the potential to create many opportunities for improvement. Western Health is engaged in these discussions related to the Provincial Health Authority to represent the unique needs of our population and communities in Western region, which our board chair also spoke to as well. Over this coming year, there's lots of work required to continue for replacement